for our update of the current measles outbreak in South Carolina. I'm announcing that yesterday, the South Carolina Department of Public Health, or DPH, updated the number of confirmed measles cases in 2025 in South Carolina to 16 since July. 12 of those cases are directly linked to an ongoing Spartanburg County outbreak. The 5 new cases since the previous update are among individuals who were close contacts to known cases, and none were present in any school settings while contagious. Because they were quarantining at home before they became infectious, no additional exposures occurred with these new cases. While the 5 cases may appear as a large increase, the early quarantining as a result of their identified exposure is actually a successful public health outcome that shows how rapid containment efforts around known cases and quarantining those known to be exposed is highly effective in preventing community spread. I'm going to stop here for just a moment to ask everyone to please make sure that your lines are muted. I'll also announce that DPH has identified Crunch Fitness's location at 1332 South Pleasantburg Drive in Greenville, South Carolina, as the source of a child's exposure on September 30th that was previously reported. DPH is asking anyone who was at that location on that date, September 30th, only between 11 a.m. and 3 p.m. to see their healthcare provider if they are not vaccinated or unsure of their immunity and believe they may have been exposed. As of today, no new students from the involved schools have been excluded from school activities, and the number of students quarantining at home at those schools is down to 139 following further investigations into potential exposures. I want people to be aware that DPH's 2025 measles outbreak page has been updated to include a link to the latest 45-day school reports that include school attendance figures and vaccination percentages for public and private elementary and secondary schools statewide, organized by county. And additionally, we have now identified and scheduled where DPH's mobile health units will be deployed, offering measles vaccinations for interested community members. This Thursday and Friday, DPH's mobile health unit will deploy to Mount Moriah Baptist Church at 445 South Church Street in Spartanburg. The hours of operation will be Thursday from 2 to 6 p.m. and Friday from 1 to 4 p.m. These times, as well as additional dates and locations for the following week, will be provided in a separate release that we will share with you this afternoon. And before I take questions, I want to emphasize that although we were able to recognize illness in the 5 most recent cases before they could expose others due to effective prevention measures, earlier cases were not identified and resulted in unrecognized community transmission. We actually anticipate that more cases may occur. And it's important to note that the measles virus won't be contained within schools, within school districts, or by county lines. But the MMR vaccine, by providing lifelong immunity to the majority of those vaccinated, will contain the virus. And for this reason, we're urging those who are not vaccinated to consider getting that protection now. And with that, Ron, I'll turn it back to you to help me take any questions. Thank you.
Absolutely, and thank you so much for that, Dr. Bell. As I mentioned before, if you just joined the meeting, raise your virtual hand. I'll call on you in the order in which it was raised. Please save any follow-ups to give other people an opportunity to ask questions first, and then I'll be happy to come back to you. When I do call on you, even though I'll say your name, if you could please state your name and your affiliation, that helps us with tracking. And I'll start with Christian. Go ahead, sir.
Hi there, it's Chris Benavides from CBS News. Our question was, do we know if the exposure came from unvaccinated kids? And is everyone who is infected unvaccinated?
All of our current cases, to our knowledge, are unvaccinated.
Thank you. Erica Edwards.
Hey, thanks so much. This is Erica Edwards from NBC News. I'm wondering if you've reached out to these folks who are quarantined and offered MMR shots to them to help boost their immunity, and whether any have accepted.
Well, offering the MMR vaccine is only effective in preventing disease if it is provided within 72 hours of the exposure. So offering vaccination for those beyond that period is not shown to be effective in preventing illness. People can receive the measles vaccine, and we are certainly offering the MMR vaccine to people who have completed their quarantine period, as long as they do not become ill during the quarantine period, which would give them immunity from natural disease, unfortunately.
Thank you for that question. Alyssa, go ahead with your question, please.
Hi, Alyssa Young with Spectrum News. So earlier you stated that 139 students are still currently quarantined. What was that number? Like, that number went down. What was the original number?
So I can't go back to the original number because I don't have that in front of me. But from the initial investigation, we were excluding all that we believed to be exposed. But as the investigation continued quickly within the next day or so, we identified more among that group of excluded who were actually vaccinated and did not require exclusion.
Okay, thank you.
Thank you. Ray, go ahead with your question.
Yes, I do. Good morning. Good afternoon, Dr. Bell. I was poring over the vaccination rate and data that you all shared on your website. I saw that Spartanburg County, where these cases have been outbreaking, has the highest rate of religious exemptions in the state at 8.2%, but also has the lowest immunization rate in the state at 90%, one of the lower ones at 90%. Are you all concerned by the increasing rate of religious exemptions and the decreasing rate of immunization rate in South Carolina as this outbreak goes on?
Well, we are certainly concerned about the declining vaccination coverage that would bring what we consider herd immunity to this population, because the measles virus is so highly contagious. When that vaccination coverage level starts to drop to about the 90% level, which is well below 95%, the level that is most effective in providing herd immunity, it does cause us great concern. And then we recognize from one school to the next, when there are lower vaccination coverage rates or higher level of exemptions, that specific school population may be at higher risk than would, say, other schools in the same district or in the same county that have higher vaccination coverage. So transmission is highly dependent on a number of factors. It's population immunity, but it's also in the school setting where we have congregate settings with close contacts. The coverage within a school setting itself is really very important and of great concern when we see a school that has low immunization coverage.
Thank you for that question. Jane, go ahead with your question, please.
Hi, Jane Caroline Fusco with ABC News 4 in Charleston. Talking a little bit more about the gym setting exposure. Is it concerning, or should South Carolina residents be concerned that it's now exiting school areas and coming into a place where every day people go?
Yes, at this time, now that we're seeing transmission in South Carolina, we don't want anyone to have a false sense of security if they have a known location where measles transmission has been identified. We want people to be aware that we have unrecognized transmission and evidence of transmission in the community, so that exposures can be unexpected, can be unpredicted. And for this reason, we continue to encourage everyone, now that we are seeing transmission in South Carolina, that everyone should consult with their healthcare provider. Make sure that they're up to date on their measles vaccinations, because we are concerned that while we're focusing on the Spartanburg County area, that travel can occur. People can travel to other areas where measles transmission is occurring. People can travel now within the state and be exposed to measles. So this does concern us, and we just continue to emphasize everyone to please take advantage of getting protection from the MMR vaccine as quickly as possible.
Thank you for that question. Mr. Garcia, go ahead.
Thank you. Luis Alfredo Garcia, South Carolina Public Radio. Do you have any guidance for parents who may not have children who attend the two identified schools, but may have friends there who, see these children regularly or may do extracurricular activities with the children at the schools who were quarantined?
Well, yes, through our investigations of the contacts of cases, we believe that we have identified those contacts who are not yet ill, but who are in quarantine. So for parents whose children attend those schools or friends of children who may attend those schools, the contacts to people who are not ill and could not be showing early signs of illness would not pose a threat to the other social contacts. The importance of quarantine, though, is to keep people in quarantine during the maximum incubation period, which is 21 days, because they may develop symptoms and could be spreading the virus before they're aware that they're ill, because this is before the rash has occurred. And so this is the reason behind the quarantine, that we're keeping those people who have been exposed, excuse me, away from others. And so the risk in the general population to those direct contacts for that specific scenario is not a concern. However, as I stated before, if they're unvaccinated, those exposures can be unrecognized if there is unrecognized transmission in the community.
Thank you for that question. Jessica, go ahead with your question, please.
Dr. Bell, this is Jessica Holdman with the South Carolina Daily Gazette. The question I had was related to the gym exposure. Have you gotten any sense at this point how many unvaccinated folks may have been exposed at that location?
That's an ongoing investigation, and that facility is working with us to provide the names of the children who may have been dropped off at that facility during the time frame that I mentioned, and we have not yet confirmed the vaccination status of the children who were there at the same time.
Thank you, Jessica. Allison, go ahead with your question, please.
Hi, Dr. Bell. I'm Allison King with ABC News. I was wondering if you've been in touch with the CDC, and if so, have they deployed any personnel or provided any supplies for the measles outbreak?
We have been in touch with the CDC. We have been reporting our confirmed cases to the CDC as per protocol for our national surveillance system. And the CDC has not, nor have we requested that they deploy resources to South Carolina in response to this outbreak.
Thank you for that. Christina, go ahead with your question, please.
Hi there. Good afternoon. Christina Feliciano with Fox Carolina News in Greenville. Thank you for having us. Just to kind of put this into perspective, maybe parents watching this story might be concerned. There are always symptoms or risks when it comes to the vaccines, as far as vaccine injuries. Could you kind of put into perspective what the concerns are with that? Is there a high risk of any vaccine injuries for children or adults, or is that such a low risk where it is still important for them to consider those vaccine options?
It's still very important for parents to consider this vaccination option, because the current MMR vaccine that we're using is the one that's been used for decades. It's the same vaccine that was highly successful and responsible for us being able to eradicate measles transmission in the United States 20 years ago. Now, all vaccines, or all medications for that matter, may have some adverse side effects. Those most common with the measles vaccine would be a local reaction, soreness at the arm, at the site of the injection. But what we want people to pay careful attention to is that the complications from the disease itself far outweigh any rare adverse events that might be associated with the vaccine, so that complications to from the measles vaccine do not in any way compare, which are the most severe, most commonly are actually an allergic reaction. But the disease itself can result in hospitalizations for particularly young children, secondary pneumonia, which is the most common cause of death in young children. It can result in a swelling of the brain that can result in permanent neurologic complications, hearing loss. And so those serious complications, hospitalizations, are the greatest concern and are preventable with the vaccine.
Thank you. Eduardo, go ahead, sir.
Hi, thank you for having us, Dr. Eduardo Cuevas, USA Today. I guess in this current outbreak, are you seeing particular under-vaccinated populations, such as religious or other subgroups that are affected? And if there is not a trend with a specific population, does that raise concern for you? Thank you.
Well, in our 45-day school report that is posted and available, you can see the percentages of religious exemptions and medical exemptions, and any reason for individuals not being vaccinated causes a concern for them being at risk of exposure and developing disease, whatever the reason. For those who are able to receive the vaccine, and the choice not to do so does give us great concern because those individuals are not protected. It also prevents us from establishing herd immunity. It helps us from protecting those who cannot be vaccinated, either because they're too young or because of underlying medical conditions or because the vaccination is not recommended in pregnancy. High coverage in a population also protects those who cannot be vaccinated. So we do encourage those who can make a choice to make that choice to protect themselves and to protect the population as a whole.
Thank you for that. Tom, go ahead, sir. Tom, I believe you're still muted.
Hey, sorry, I was going on and on. Tom Corwin, Post and Courier. If you look at the rate of religious exemptions, in particular for Greenville County and Spartanburg County, those have essentially doubled or more than doubled in Spartanburg's case since the pandemic, since 2020, 2021 school year. What do you attribute that to? And I think you've said all along this is a concern when you have a higher number of those exemptions.
Yes, we have seen more and more vaccine hesitancy, more and more vaccine resistance since the COVID pandemic. And not just against the COVID vaccines, but also against vaccines that have been in use, as I've mentioned before, for decades. Another concern in particular about this low coverage in the school districts in the upstate is that they are also have among the highest enrollment in the state. So when we look at those percentage points across other school districts where the enrollment can be lower, the fact that this is a large number of students among the highest enrollment in the state that has lower vaccination coverage is an additional threat to the population in general because of the obvious interaction between those schools and the surrounding community. So that's just an additional concern for that vaccine hesitancy, vaccine resistance. We have seen that, as you mentioned, an increasing trend for years, for the last several years in that part of the state, and that puts us at risk not just for measles, but we continue to see outbreaks of other vaccine preventable diseases in that area of the state as well.
Thank you, Tom. Deidre, go ahead, please, with your question.
Hi, this is Deidre McPhillips with CNN. Thanks so much for keeping the lines of communication open around this outbreak. I was wondering if there are any factors that have been constraining your response. For example, has the community been responsive to questions from epidemiologists in the health department, and have they been respectful of quarantine?
Yes, we are very grateful for the cooperation that we've received from the involved schools in working with us and communicating with their families and their communities and helping us get the word out about the fact that there have been exposures in those school settings. We're also very fortunate in that we have provided guidance to the cases to remain isolated from others while they are infectious, as well as those who are in quarantine to remain in quarantine. And so there is a great benefit to us in preventing spread of the disease by following these effective disease prevention and control measures. And again, we are grateful for that cooperation that we have received so far from those involved.
Thank you. Ray, go ahead with your follow-up, sir.
Hey, Dr. Bell. So I noticed that the Global Academy of South Carolina, according to your data, has a 17% vaccination rate, meaning that all the students had all their shots. Fair Forest Elementary had an 85% vaccination rate. Is there a difference that you have seen between vaccination rates in public schools versus private and charter schools? And is there any thing that you all can do as far as limiting the number of religious exemptions that people are allowed to get?
Well, I can encourage those to look at the data that's available. It's not necessarily that we are seeing lower vaccination rates by school type. As I mentioned earlier, this can vary from one school to the next. And the thing that we can do to address that is really exactly what we've been trying to do, is to make everyone aware as quickly as possible about the status of the outbreak in the state, so that they're aware of cases occurring, and when cases increase in number, the general area where they're occurring, because again, just knowing a specific location does not mean you're protected. It's important to have awareness that there's transmission in your community. And we continue to promote the effectiveness of the vaccine, because that is really the most effective disease prevention measure that we have to give people immunity before exposures occur. And so those community outreach efforts to provide education, to provide actionable data, and also to provide these vaccination resources, not only through our Department of Public Health services within our clinics or through our mobile health units, but also making people aware from our website. They can use our vaccine locator to find other locations in pharmacies or other clinics, federally qualified healthcare centers where the vaccine may also be available.
Thank you for that. Tom, you have a follow-up?
I do. Thanks for taking another question. When you look at some of the counties and their immunization rates, even taking into account the religious and medical exemptions, it doesn't account for all the students who are not immunized. In some cases, it's a pretty large number of kids. It's something like almost 3,200 kids in Horry County in the 2024-25 school year. It's almost 16% of kids in Jasper County. So when you have that situation where there's not a medical or religious exemption, but these kids still aren't immunized, what's going on in those counties, those schools?
So the exemptions, I want to make a point clear about the two types of exemptions. Medical exemptions are issued by a healthcare provider and are typically due to a specific reaction or contraindication to receiving a particular vaccine. So for example, a child may have an underlying medical condition that they can't receive a certain vaccine. A medical exemption usually applies to just one vaccine or a handful, whereas medical exemptions is a choice made by parents that generally applies to all of the vaccinations, although sometimes an exemption may temporarily be requested so that they can get their vaccinations on an alternate schedule that is usually not recommended. Now, how those parental choices are being made from one county to the next has more so to do with the parent's choice than something going on in the school. And just one more point, as you brought up Jasper County, I would again acknowledge that while Jasper may have a relatively higher exclusion exemption rate, the enrollment of students in Jasper County is much smaller than it is in, say, Greenville, Spartanburg. So again, when you look at those percentage points, you also have to look at the percentage of the total number that we're talking about. And again, this raises our concern in the Upstate because of the large number of students enrolled in the Upstate region.
Thank you.
Thank you. Christian, go ahead with your question.
Just for clarity, the outbreak initiated at the schools, right? That's the source of the outbreak, not the gym. Is there like just a timeline to understand like when the first case happened and compared to the gym case?
Well, we made public notifications when we identified each of those cases. So there you will have the timeline. And as far as, and similarly for the child that was identified as having been infectious while at the gym. I'm not sure if that answered your question or not.
I think it was just, did the kid at the gym happen after the outbreak at the school or beforehand was my question. Are they considered part of the same cluster or is that separate?
Any epidemiologic linkage between the child at the gym and the earlier cases, because we're still investigating that, have not yet been established. But to our knowledge, I am not aware of any connections with the students in those involved schools.
Thank you for that. Eduardo, go ahead with your question, sir.
Thank you. And just rephrasing my question a bit, in West Texas, we saw a Mennonite community where outbreak was first identified earlier this year. We've seen Hasidic communities in New York City a few years back. Is there a specific trend you're seeing in the population affected, or is this more related to the schools themselves?
It's not necessarily related to a specific population here. We are seeing religious exemptions, that choice being made through parental choice from a variety of different individuals.
Thank you. Deidre, go ahead with your question.
Hi, thanks again. I was wondering, you mentioned that you do anticipate more cases being reported. Have you done any modeling, or do you have an estimate as to how large this outbreak could grow to?
So disease modeling is available. We haven't necessarily applied that to our outbreak because one of the reasons is there's a tool on the CDC website that can be used to model. They actually, you have to enter a certain at-risk population that we fortunately have not reached that at-risk population yet. However, just from historical knowledge of how the disease is spread, we do know that if you introduce a case of measles into a highly unvaccinated population, that as many as 18 to 20 contacts who are unvaccinated and exposed to a case may develop disease. And another way to look at that is that about 95% of the people who are unvaccinated and exposed to a case will develop measles.
Thank you. Christina.
And just going back to that case from the Crunch Fitness, I believe on September 30th, I know there's still lots of unanswered questions. You say that it's still under investigation, but is that kind of, are you telling people that they can expect more cases to probably be confirmed from that one here, specifically in Greenville County, or that's still kind of up in the air?
So anticipating additional cases is not specific to those exposures that occurred at the gym. I'm saying that in general, because some of our earlier cases had no known source, no identified history of travel, that was an indication that we have unrecognized transmission in the community in general. And for that reason, people should be on the alert for that possibility and should consider getting vaccinated quickly before we see an increase in more and more cases, hampering our ability to maintain containment around the cases that we are aware of now. There's the possibility that we would move into what we call mitigation, which is when we would lose our ability to implement containment measures around known cases, and we work on mitigating when we are seeing transmission that we have not recognized, making it much more difficult for us to isolate cases during their infectious period, or to quarantine the close contacts of cases. So the point is that we, at this time, really want to focus on containment measures in the community, letting people know that there's unrecognized transmission. And the best thing to keep us in this containment mode to stop the spread is to rapidly increase our immunization coverage level in the population as quickly as possible.
Thank you for that, Ray. And then this will be the final question for Dr. Bell. Go ahead, sir.
Thank you, Dr. Bell. Just a quick follow-up on the quarantine aspect of it. We have an email from a viewer asking if the state agency issued any technical quarantine orders, or was there any other state agency? Like, how did the state agency issue these quarantine orders? Did you issue them yourselves, or was it through another agency?
The Department of Public Health did not issue quarantine orders. What we provided is to those who were known to us as exposures, we provided them guidance that they should remain in quarantine away from others until the maximum incubation period of 21 days from the time of their last exposure to the end of the quarantine period. So that is a difference from a quarantine order. We provided guidance, and again, we are grateful for those who have complied with that guidance that they should remain in quarantine until the end of their incubation period.
Dr. Bell, I just want to thank you for your time today and answering all these questions. I want to say thank you to all of our media partners for covering this important story. We appreciate y'all's patience with us as we try to make access as fair and equitable for everyone. We know that the demand for information is high, which is why we are updating our website with new information Tuesdays and Fridays at noon, and then providing this 1 p.m. Wednesday media availability to answer your questions along the way. If you have any other questions that come up, you can always email media@dph.sc.gov, and we'll do our best to give you written responses during that time. A recording of this briefing will be available on our YouTube page as soon as the meeting is over and it has a chance to upload. And with that, I'll say thank you so much, because we really do appreciate your role in educating the public about this measles outbreak, and we thank you for your time. Thank you.
Thank you, everyone.